Well, hi, everybody. Welcome to tonight's lecture. I'm filling in tonight, and I'm going to do one of the topics that's dear to my heart, and that is lingual orthodontics. And I'd like to thank the late, great Stuart McCroskey, who, when I was a new graduate orthodontist in Australia, taught me a lot about the technique of lingual orthodontics, such that I then proceeded to the USA, and I learned from a guy called Craven Kurtz. And Craven have an amazing practice in Beverly Hills. Back then, the lingual brackets were quite bulky. There was a lot of wire bending. Case finishing was difficult. I guess the equivalent to what aligners were a few years ago, right? I then continued my journey in lingual orthodontics, looking eventually for something that was chairside, a little bit easier to use and to teach. And I met Dr. Patrick Curol in France, and he had teamed up then with Philippe Salah, who's a PhD in biophysics, and they came up with one of the first self-ligating lingual brackets. And I'll go through the benefits of this. And remember, for those people who are doing aligners like me, and I do a lot of aligners, there are some cases which I just find the mechanics of aligners don't lend themselves to, and I still prefer to use braces. But of course, the patients are quite fastidious, and they don't want to show braces, even the ceramic braces, right? So when I'm faced with an adult patient and I need to give them choices and possibilities. Sorry, I'll just make sure my microphone is switched on here. Yeah. And just from a housekeeping point of view, if you're joining this seminar a bit later than the start time, it will stay on my Facebook for the next 3 to 4 days. After that, it will go to a website called eodoteachable.com. And from there, you can view it at your leisure, share it, and also do multiple choice questions that gives you a CPD certificate, right? So getting back to my pathway in lingual, it started with the Craven Kurtz Series 7 Ormco bracket. And for those of you who've been doing lingual for a while, you remember that was quite a bulky bracket. It affected speech, but it was a novel way. This is well before the days of aligners. It's probably the true invisible way of doing orthodontics back then, right? As I said, what patients do I use lingual for? Those who biomechanically I feel their case is too complex for clear aligners. Those patients who just admit that they won't wear clear aligners, or those patients who I've started Invisalign and then I realize the hard way that they're not wearing their aligners, right? So these are the type of patients that I would recommend lingual brackets to. So a little bit about the founder of the system that I'm using and recommending, and it's by American Orthodontics, but all the manufacturing is done overseas. It's done through a lab in Japan, Mr. Aso, ASO. They do all the computer engineering, and then the actual manufacturing, robotic engineering is done at their facilities, but it's in the Philippines. So as a result, it's very good for me in Australia because I can get the case turned around very quickly and shipped very quickly because it's a very similar time zone. But getting back to Patrick, he graduated at Columbia University, and then he was in private practice in Paris, limiting his practice to lingual and doing over 300 cases a year. And he also realized the difficulty in more traditional systems. So he started Harmony in 2007. And what his design goals was he wanted lingual appointments to be as predictable as labial appointments, meaning same chairside time, same scheduling. He wanted the accuracy and the finish to be good. Because up till now, when a lot of the lingual cases, they did the bulk of the work, but you had to finish in things like a tooth position, right? And I learned from two greats, Craven Kurtz with the lingual system, and then Jack Sheridan, who many of you who will remember as Jack the Stripper, we call him, because he developed the ARS technique. He also developed ESSEC aligners to do case finishing. So 90% of my lingual cases back in the day, I did the lingual brackets. I got as close as I could get with the current technology. Then we took the braces off. We took study models. We reset the teeth in plaster. And then we made ESSEC vacuum form retainers. And that gave us simple movement. It allowed us to settle. Now, of course, with the technology, we have the same digital scan. I can send to my lingual lab. I can send to my aligner lab. I can send to my labial lab. So, the open file is what we're talking about. So we want accurate finish. We want chairside time to be predictable. We want patient comfort. The reason I think this system was called Harmony is because the philosophy for the lingual needed to be in harmony with the labial. Now, I automatically saw the benefit of this because I've been a self-ligating bracket user for many years. So having the ability to use the same technology, the same type of wires, and a very similar archwise sequence on the lingual as I did on the labial immediately led me to this. So let me go through the features of this. Now, I'm not a sales rep for Harmony. I'm not one of their instructors or, etc. It's just a system I use and I like teaching and I share with my students around the world. And I'll give you the name of the main person at ASO Labs in Japan who heads up the lingual setup, and she can help you more. We do courses in Australia, which are a combination of a hands-on practical as well as theory. And in those courses, we cover more things such as the bonding principle, the debonding principle, and a few tips and tricks. But today's lecture, because it's only a short lecture, it's for an hour, is a bit of an overview of why lingual, and if so, what lingual bracket would you like to use, right? So I use on the labial Damon brackets, and Damon are a passive self-ligation, right? And sometimes it is difficult to express torque in that system. So I have to express the torque normally with bends in the wire or pre-torqued wires. With the Harmony system, it's also a clip, so it's a self-ligating bracket, but it's interactive. And I'll explain what that means in a moment. It's fully customized. So if you do lingual, you'll realize that the anatomy on the inside of the teeth is totally different to labial anatomy. The anatomy on the lingual of people's teeth is as unique as their thumbprint. And that's why when we do lingual, there is a higher premium, both for the lab fee and for the patient. And I explain to them, it's like getting a suit made, not off the rack, but a bespoke, tailor-made, two fittings type situation. So the customized pads means that we can get an accurate fit onto that lingual anatomy. Then when we've decided in our digital library which bracket would best suit that tooth, we get robotically formed archwise. So gone are the days when I started doing lingual, we had to do the mushroom loops and do the first, second, third order bends. That was quite difficult. Now the only loops I really do is sometimes when I'm doing extraction cases, I do some closing loops. But other than that, all these wires are pretty much pre-bent for you. Now to put the brackets on, accuracy is important, particularly if a bracket comes off during treatment. You can't just get another bracket out of the drawer and bond it like you do on the labial. Here, you need to have the same bracket in the same position with the same amount of adhesive so you don't affect the setup. And I think these anterior positioning jigs, which come either you can bond it one by one, which takes ages. What I tend to do is bond the whole arch. And if there's no room for a tooth, I'll keep that bracket aside until I make the room with the night-eye wire or with coil spring. And then I'll come back and use the individual jig to bond. And I can always use that individual jig because it uses the labial surface of the tooth and the incisal surface as a location key, right? But the real advantage of this system, like anything in orthodontics now, is it's fully computerized. And so, we call it digitally assisted treatment. So I'm a big clear aligner user. I use Spark because of the technology, because I can start looking at the roots of the teeth on my CBCT. I do my labial indirectly using Insignia, right? So I guess our practice is like a full digital workflow, and I like that. Why? I have a number of operators who work for me, and I don't want like a right-handed person to put brackets on differently to a left-handed person. So, it just allows us to work together on the same patient with the same goals in mind, right? So they're the 5 features of Harmony. So let me explain the term interactive self-ligation as opposed to active self-ligation or passive self-ligation. So what you'll find here, when you start the case, you'll use a round NiTi like an 014, and it will bounce around in the slot, which is really comfortable for the patient. But the power of these NiTi wires is they allow arch development. And that's the big win compared to clear aligners. When I have a clear aligner case that needs a lot of arch development, I either have to use a separate expander, like an alpha appliance, then I scan for my aligners, so I don't have to do as much stripping. Or I say to the patient, look, why don't we just go on the Lingual, and I can use these magical NiTi wires, give you the expansion, I don't have to strip. The number of patients I get who come in unhappy when they're in the mid-treatment of whether it's Invisalign or one of the other brands, saying, look, I wasn't told that they were going to strip my teeth. I wasn't told that I'd have these, they call them, some people call them warts on their teeth, which are, as we know, are the attachments, particularly when they discolor, et cetera, et cetera. So if you want to talk about true invisible orthodontics, I think Lingual is the way. But having said that, I'm not an exclusive Lingual guy, nor am I an exclusive aligner guy. I just do what's best for the patient, and I've taken the time over the last 32 years of educating myself in different systems. That's why I love teaching, because every day I learn something new, and I love sharing that new technology with my patients who also get excited. It's really important that you tell the patients how important the technology is, right? So a passive bracket means that when the wire is in, it's not contacting the clip. So initially with the round wire, this becomes the passive system. Then when you go to the rectangular wires, as you level and align, you start getting the concept that you still are not touching the clip, but you're able now, as I said, to do a little bit more as far as your rotations, etc. And then when you get to the 1825, now it becomes active because of the contact of the wire to the clip, and that helps me a lot with torque expression, right? So just looking at this little video, and I thank American Orthodontics for these slides, and particularly Steve, who's been the Lingual guy at that team for many, many years. So here is the round wire. It's bouncing around, and you drop it in, then close the clip. And I'll show you how to do that later in the lecture. It's very, very simple. So when you want to change the wire, you open the gate, close the gate or the clip, and again, you're getting some interactive control here, but you're still getting 7 degrees play of torque because you're not fully engaging the slot of the bracket. And then continuing to work up the wires, we're going then to, and this is showing you how with that wire dimension, you're still getting very low friction, right? And the rectangular gives you active rotation control, which you don't have in the round wire. So I can get my tipping or angulation, I can get my rotations sorted out in these rectangular wires. Now, the third order movement, which is the torque, which is most important, I think, in finishing, is then achieved with your 1825. And all of these are NiTi wires, right? So now with that 1825, I'm getting full torque control, full angulation control, full rotation control. I'm really expressing what the Lingual setup was. So it's a very precise system because the brackets are custom made, the indirect bonding is custom pad, and the wires are robotically engineered or customized for the movement you're achieving. And I'll talk to you about how you select that wires in a moment, right? But that just kind of gives you a bit of an overview on this amazing system. So if I compare that to, say, O-ring, and as you know, I've stopped using O-rings both labally and lingually for a long time. I find tipping of the roots can be difficult to control from the lingual when you have to rely on elastic ligatures, right? So the concept here is that if I want to get better control of my axial and my rotation, I really, and I'll show you with some cases, I really find that when I put the wire in with the O-ring, the wire on a rotated tooth will tend to come out on one side versus the other. So that's not really giving me the control that I'm hoping for. So you can see here exactly what I'm talking about. Can you see in this setup how you've got this central incisor rotated, and you can see that if you had an O-ring there, if I put my cursor, the wire would be coming out on that side, right? So it's not giving you true control. So the passive metal clip, just like in Damon, gives you very good control of that. And people say, well, how in a case like this do you make room? And those people who are used to aligners only will think, where do I strip and how much do I strip? You know, those who are used to passive self-ligation brackets will realize that the benefit of the night-eye wire in that slot bouncing around gives you very good arch development. That's what it's good for. Now that resin you see on the back teeth is what we call disclusion. To help that arch development, we want to keep the buccal segment apart, and it's nothing to do with trying to prevent breakages of brackets because of the bite, etc., right? Yeah, so you can see in that case, the round wire, 014 working up to the rectangular wire, and all of these bent for you. You can see that really precise delivery of the torque, the tip, the rotation, and you get very predictable movement. How do I know that? In the older lingual systems, when I looked at the proposal, which back then was, you know, a photocopy of a wax setup, it was never that I could take the brackets off and the wire and put it on the proposal and it would fit perfectly. With this system, I actually can. So it's very, very precise. So what else I like about it? Well, just like when I did O-rings on the label, it takes a while to put the wire in and put the O-ring around it and, you know, et cetera, there's plaque accumulation. Now, when you have to do rotations on lingual, you have to do things like double over ties, etc. They're much harder to do on the lingual, and they require a lot more chairside time than the self-ligating clips, right? So if you compare the other systems on the market, you've got the plaque with the O-ring, you've got the less control and chairside time, right? So let's look at this little video. This is an extraction case, bidental protrusion. And the Y sequence for extraction cases is different to non-extraction. I'll touch on that later. We want to use a different type of wire. We don't want the wire to be close fitting to the brackets with lots of bends. We want it to be more in a straight wire system so that we can slide en masse. So what's happening here, you're using the opening clip to open all the clips. And there's little techniques, and I'll share with you, for those who send me an email, the teaching videos, which are really, really good. So as I said, your arch wires are pre-selected. Now let's just say this is your first wire, your 014. And remember, it's very important you put this wire in the right way, because the right side is different to the left side, even with the bends, right? So that's kind of, now when I place the wire, I use something like a flat on flat. This is like a Jarraback plier or vine guard. You place it through your terminal molar tube, and then you know where it's going to go in the midline. So you then basically start ligating the or closing the gates as you hold with your fingers. And the concept in doing this is then to just allow movement to occur so that you get the wire exactly like the lab and the robot engineer had done that. And when I went to the ASO facility in Manila, I was amazed at the high technology in that robotic machine. It really makes you think that normal orthodontics is like being a caveman, right? So you can see sliding it in initially into your tubes, then bringing it forward, and then closing the clips. And one thing about Lingual, let me tell you, if you leave too much wire poking, it is really going to irritate the tongue. So I'll give you some tips on how you can use special cinch back pliers to get the extra wire on the terminal molar and point it towards the gingiva and towards the distal. So that way you don't get the patient complaining about the irritation. But you can see how quickly that wire change does. Now, obviously, your first case will take a bit longer, and I thoroughly recommend you get the Typodont kit from American Orthodontics so that you can have a go at doing this on your Typodont. And you know, as I said, as you have really difficult rotated teeth, sometimes I don't want to bend that wire that much. It becomes inefficient. What I'll then do is just leave that wire out of that bracket, or might even not even put the bracket on at that stage, because I can come back and put it on individually. So it's a lot to do with binding. Remember, we talked about the low friction. We also want the low binding. There's two types of friction: sliding friction and binding friction. And binding between the arch wire and the bracket slot as a result of that wire curvature, with less play between the wire and the slot, the binding will occur with smaller, smooth curvatures. And that's why I tend not to do heroic bends like that. This diagram comes from the excellent textbook by Dr. Scuso and Takamoto, the STP, and they also have a self-ligating system from Ormco. So what we're showing you is the curve radii at clinical settings. If you look at the 1-2, it has a curve radius of about 6 millimeters, where the tight curve of the arch wire to the disc of the bracket on the 1-1 has a radius only of about 1 millimeter. So that's why in those tight curves, I prefer to leave the wire out of the slot, right? So again, just what are some advantages in this system? I'm finding that I can shorten treatment time compared to aligners, no doubt about that, right? Because I'm doing multiple movements at the same time rather than waiting a sequence of aligners. I'm not worried about compliance. You know, is the patient wearing it 24 hours a day as they're supposed to? You know, in many countries, the staff do all this. In Australia, of course, as you know, only a doctor is allowed to do this. And as a result, for me, my most valuable asset is time. So what I want to do is have less time in the chair and have a wire that I can have extended appointment slots. You know, with these NiTi wires, I'm able to do the thermal NiTis, I'm able to do 8-week and 10-week appointment rewires, which is fantastic news for me. So let's talk about the base, right? So when you get a labial bracket, if it's not like a fully customized bracket, such as the Insignia, etc., you'll have some rocking because you won't get a perfect fit. With this custom base, you have a patient-specific bonding pad, and it's created from a highly accurate digital scan of the patient's dentition. So that base adapts exactly to the anatomy of the tooth, right? And that's why you'll see in a minute, when you send your scan to Azo laboratories in Japan, the computer technician there has a library of different types of bases, or you can just create a base specifically for the anatomy of that tooth. And then once he's got the custom base, and that shows you exactly what I was talking about, then if you ever get the opportunity and you are, when travel restrictions subside, going to Japan, send me an email, and Mr. Azo and his team are just so accommodating, and you really learn a lot just by seeing what goes on behind the scenes from the moment you do your lingual scan, or if you still have the older PVS, I guess, you know, but honestly, digital scanners are the way to go. So from your digital scan, the teeth are reset into an ideal occlusion. You confirm that. They then select the bracket so that it's out of the occlusion in many cases, as you can see here. The custom pads are designed on the approval setup, right? So that means that if you look at the malocclusion and you were just to put a normal bracket on and not realize that the upper hits the lower, then that increases the likelihood of a debond. Having said that, these things fit on so well that it's next to impossible for a bracket to debond, but you're always going to get the patient who pushes their luck and chews a bone or you know, some sort of gobstopper or something like that. Now, the bracket itself, not the clip, but the bracket is produced with the metal injection molding. So you get a very smooth contour, which is important for the tongue. And then the MIM bracket and the custom base, the way they're put together is to give you the maximum benefit of movement, right? So if you compare MIM, the brackets that are metal injection molded have less striations compared to, say, the cast brackets. And again, that's important for friction and for comfort and for plaque control, et cetera, et cetera. I sometimes put a band on the tooth if I'm, say, combining an expander with my lingual, or if I'm doing a bite jumper with my lingual. We'll talk about those cases when you do more advanced courses, but you can customize whatever you want on your 6 or 7 to accommodate whether you're using an elastic, whether you're using a bite jumper, et cetera, et cetera. Now, in between the MIM bracket and the custom pad, we have what's called a custom adapter. And that integrates the custom pad and the self-ligating bracket together. So that gives you the full 3D control of each tooth, because it gives you the means to orientate that bracket slot in all 3 planes of space. And that's a very, very clever design, right? So you've got the clip, which is passive, then becomes interactive. You've got the custom pad, and then you've got the slot adapter that allows that 3D control. Right now, I'll talk later about what pads are available, but you can get partial occlusal coverage, you can get the standard pad. It all depends on the type of malocclusion you start with and what attachments you may want to put on there. Excuse me, I'm going to get some water. Yeah, so getting back to the customized band, it allows me to expand my treatment options. Here, you've got a class 2 corrector done lingually, and you can have a expansion component if you need more than what the arch wire is able to give you. If I'm using intrusion mechanics with a TAD, or I need boost anchorage and retraction, and I don't want to use the TAD, I can use the TPA. You know, so I just got to speak to the technician exactly what I want, right? So we've got the pads on, we've designed where the bracket should sit, and now we customize the wire, right? So initially, with your round wire, and again, just showing you here what happens with an O-ring and the position of the wire. If you are doing an extraction case and you've never done lingual, remember it's very irritating on the tongue where the extraction is. So what we normally do is put some bumper sleeve there. And lingual patients are really fastidious. So if I'm doing a 4 bicuspid extraction case, the last thing I want to do is show 4 gaps at any stage in treatment. So for lingual patients, on the buckle, on the buckle of the premolar, I'll do what's called a composite wing. So I've got composite covering the extraction socket from the labial, and then as I slowly retract to close my extraction space in a bidental protrusive patient, I'm trimming that composite until the tooth is touching the adjacent tooth and the extraction space is closed. And we'll touch on that in more advanced courses if this interests you. Now, what are your choices when it comes to robotic wires on the lingual, right? Now, if you want to do true straight wire, it's kind of hard on the lingual, right? Because if you look at the in-out of your cuspid and your bicuspid compared to your incisors, by the time you get just a clear wire, or what's called a straight wire, which is what you're used to on the labial, can you see where my cursor is, how much in-out you're going to have in? That's going to be really bulky on the tongue, right? So that's called compensation in the brackets, because the brackets are compensating for the in-out. Or you can have very well adapted brackets right up to the pad, and that's very comfortable for the patient. And that's what we call compensation in the wire. But the bad thing about that is it increases the binding. And when it comes to extraction cases, it's really hard to do the sliding, right? So what I like to do, and what the people at Arzo Lab are doing, is that they are doing the best of both worlds, and what we call a fully customized wire. So remember, straight wire, and a lot of systems now offer this, with the thinking that, oh yeah, that's like Larry Andrews straight wire, and you don't have to do any wire bending and blah, blah, blah. It doesn't really work on the lingual, in my opinion, just from the comfort point of view, right? And I'll talk to you the difference when it comes to extraction cases, right? So the advantage is, very good sliding, and that's why you'd look at that in an extraction case when you're doing en masse. Or the big disadvantage is it just really rips the tongue up and speech, and more chance of debond because of the way the shearing forces will be. When you get the robotically formed arch wire, which is what we call a close fit, where the compensation's in the wire as opposed to the compensation being in the bracket, what you see then is a real smooth, comfortable for speech, and the patients love it, but very poor sliding mechanics. Does that kind of make sense? So you can't always have your cake and eat it. I've got to pick which one I want. If I'm doing an extraction case, then maybe I want the ability to slide more, and the patient will put up with a bit of discomfort. But in most of my cases, which are non-extraction, I go for the Harmony Optimize, right? So the Optimize really gives me the best of those two worlds, because it gives me good sliding mechanics, and it still gives me that low in-out on most of my teeth, right? And because I'm not bending the wires anymore, literally, I can just tell the technician what I do. They'll put it into the system, and the wires robotically bent and engineered for me. So in a case like this, if you want to open that space for an implant, you can plan with the technician how much room you need, right? You can then, so it just allows great communication between you and the patient. And most of these patients, if not all of them in my practice, are adults. They come in with various surfaces to bond to, whether it's gold, amalgam, porcelain, et cetera, et cetera. So one thing when you do your first case submission, and I'd get the team at ARSO to help you with that, you need to select what type of appliance design customized wire you want, okay? Those who did Craven Cursor stuff, you'd be used to the mushroom type 1 and 2. They're more the traditional lingual arch forms. But as I said, with the traditional versus the Harmony system, you can do the Optimize, which means that each case is going to be evaluated to create that optimal balance between the bracket and the wire. So that's what I normally go for. Exceptions will come up as we go, right? So obviously you do your scan. You then have to select the design you want for the arch wire, and then the actual wires. Now you get a choice of 4 wires, and that's all you need, particularly in non-extraction cases. So you've got to choose the size, and normally my sequence is going to be around 014, and then I'll get a square wire, and then I go rectangular, and then I get a thicker rectangular. You got to select whether you want nitrile, stainless steel, or beta titanium. Stainless steel is great for sliding. Nitrile is good for leveling and aligning. And if I need to do some adjustments, obviously I love beta titanium because it retains the bend and is more comfortable to place that into the bracket slot than with, say, stainless steel, right? But the arch shape, you can determine regardless of the wire, which is amazing because in traditional non-robotic wires, your arch shape for your round night eye is pretty much that. You can't really put bends permanently in round night eye. With this system and with this engineering, you can, right? So your goal is to work with a technician who has a lot of experience in these cases, or work with a more experienced orthodontist who's done a lot of lingual, and come up with the 5 wires you'll have in a full arch case, right? Obviously, you get additional wires, but they're going to cost you more. And I really don't think you need more than those that come with the lab fee. So you'll get a little box, and I love these boxes. I know when I get my insignia boxes, they're bulky, and I got to store them, and I'm trying to have a office which is paper free and ergonomic and looks like you've just checked into a front desk of a 5-star hotel. So I don't really want model boxes around and things like that. This is really good because this is almost like a CD, and it keeps the wires, they're individually packaged and sterilized, and very high quality control. So you've got a super elastic night eye, and then you can finish normally in a TMA. The only time I go to stainless steel is on my extraction cases, or if I need a little bit of more oomph with the expansion. That's kind of just showing you what I'm talking about. That in the old days of indirect setups, that's how bulky storage was. Now you just keep it in the cupboard, and patients' names on the side. Really easy to sort that out. Okay, so a little bit about Y sequence. And remember, I don't expect you in a 1-hour lecture to understand how to do lingual orthodontics. But hopefully it'll whet your appetite to want to do more advanced training. And wherever you are in the world, and you want to learn some more, please email me. I'll put my email up here. Now let me see if this, I know how to machine square this. This Zoom is all still a bit new to me. Let me just try here. Yeah, so if you want information on this system and or where to do more courses, including certification courses, you can just email me. So it's info@Derek Mahony, my name, no dot, all lowercase, .com, right? So info@DerekMahony.com. Yeah, and we can talk more. I'm happy to share some of the technique manuals with you, some of the videos on how to bond, how to debond. It's a skill, but you'll enjoy it. I really enjoy lingual because the patients are unique patients, and you're not competing with that aligner market. Because let me tell you, in Australia, every man and his dog is doing Invisalign, and what ends up happening, it becomes a price war. Patients come in and say, I've seen that guy and he's quoted me so much, and whatever. So this is a sequence, and as I said, 80% of my lingual is 85% is non-extraction. The extractions I do is not because of crowding. It's mainly because of the profile. If in Australia, in Sydney in particular, we have a lot of Asian patients, Bimax dental protrusion, Chinese, and you can't treat them non-extraction if you want to get good lip competence, right? So fastidious patient, aesthetics are important, speech is important, and they want to get it done quickly. And I just find when I compare what I can achieve in a lingual setup versus an aligner setup, time-wise, it's just so much more predictable. Anyway, so in a non-extraction, as you can see in the purple here, I'm doing 014 superelastic night eye. Then I go to a square, which is 1616. Then the first rectangular, 1622. And then the last wire is the one that really expresses my torque. And sometimes I don't need torque if it's a simple case. But if I do need to fully express the customization, I go to the 1825. Now you note how that slot is the 0.25. That's very clever. Look at how Dr. Damon used to do it. His wires are all 14 by 25, 18 by 25, whereas most systems are by 22, right? So that's important when you want to get that control. Now, the red sequence is where we are going to start closing spaces en masse, and I retract upper and lower 3 to 3. Now, just when you do extraction cases, remember, if you retract upper and lower back at the same time, there's a chance the upper teeth will hit the lowers, particularly in lingual, and that will give you reverse anchorage. So that gives you such a good anterior anchorage that all your extraction space will be closed by your back teeth sliding forward, right? And then you've got egg on your face because the patient's space is closed. That's why you took teeth out, and yet they're still really full. So what I like to do is start my retraction process in the lower ahead of the upper, so I have an overjet at all times until we close lower extraction space. But I'll cover that more in seminar. So here's a typical non-extraction case. It's a very narrow arch form. And, with aligners, you're going to have to do a lot of work just to develop the arch before you start your movement, et cetera, et cetera. Plus this patient's class 2. And then, with aligners, that's going to be a little bit more difficult. Whereas here, you can run your class 2 elastics based on the design, right? So that's your 014 super elastic copper nitrile wire. It already has some robotic bends from the customization. Then after about 10 weeks, I normally look for spacing. If I see spacing between the teeth that were crowded, that's a good time then to go to my 16-16. If I don't see spacing, I'm more than happy to leave that round wire in for another visit. So I normally have the round wire visits 10 weeks. I have the rectangular wire visits 8 weeks. And then when I'm getting to my finishing wires, I make those appointments a bit sooner, so 6 weeks. But gone are the days where we had O-rings and we didn't change them every 4 weeks, we'd have problems. There's the second wire, it's a square wire. We then go up to the 1622. Now we're starting to get a really good rotational axial control. Our torque is in 1825, and you can see, I mean, this is just in a matter of 6 weeks. Now that is a simple case, but how many weeks would that have been with aligner therapy, right? So this is the thing. If you want aesthetics, which all patients want, and they want it done quickly, this is a real winner. You get the arch development because of the superelastic nitrile, and that's just a real benefit for those who've used, passive self-ligation, copper nitrile from Ormco, the Damon system, blah, blah, blah. You'll adapt to this straight away. Now, we work with the technician to kind of help with the arch width, so you might have a case that's got spacing and you want to try and bring it in together, or more than likely you have a case that has buccal corridors, you want to get more expansion, et cetera, et cetera. So what you do is you pre-select what type of movement you're going to get, and you use what's called the man trough or the mandibular arch form. So this is the chart, and this is important that you kind of sit down and understand your options with this. I've talked about the arch shape and how I like the optimized one by Harmony. We've talked a little bit about the wire sequence. I haven't as yet talked about the tray, but I like the vacuum molded tray. Some people like silicone, but we will go through those options with you. And then you've got to select what type of hook, if you're using elastics or using a bike jumper, et cetera, et cetera. So once you've done your setup option, you're kind of beginning with the end in mind, right? And that's a quote from Tom Pitts. When you begin with the end in mind, or what Ricketts used to teach me by talking about the visual treatment objective, it makes that much easier to communicate with your patient, right? So in the upper arch form, one we just looked at, obviously you want expansion. It's very tapering. Whereas in the Div 2 case, you probably want to maintain that. So you set that up in your sequence. Diastema, African-American, big tongue, Bimax case, you're trying to constrict that sort of situation. That allows that setup in there. Okay, now you've done your setup, you've approved it, the case comes back. Now each bracket has a positioning jig, and that's to help to assist with the direct bonding of those anterior brackets. Again, these jigs are produced by the same CAD/CAM technology, and they're designed to precisely fit over the occlusal surface. When I first started using the system, those jigs were metal. Now they're clear, and it's a bit easier for the UV light to set the adhesive. So let's just say this is your ideal result on the left, but that's your actual malocclusion on the right. Well, you know, it's pointless wanting to put the bracket on when you take it from the ideal setup to the malocclusion model. You know that those brackets are going to hit each other. There's no way you're going to get a wire without the excessive binding. So what you can choose to do is just leave the bracket off until that 014 supraelastic nitite has given you the room and given you the expansion. Then you can go in with your individual jig and bond that, right? So that's what we're showing you here. That's an older jig, by the way, a metal design. So, you know, those give you a consistently accurate method for direct bonding anterior brackets. And I use those, A, if there's a debond, like an emergency appointment, B, if I have to create space like you saw there, and then bond that on, right? So a little video just showing you how that jig is placed. So this is the malocclusion model just as a guide. And can you see how it's like a hand in glove precision, so that there's only one place that bracket's going to fit when you bond it. So the more accurate your bonding, the more accurate will be your end result. And this is what sometimes happens when you do aligners and they say strip 0.3 here. A, you don't know whether you're really doing 0.3. B, you don't know whether you're doing it in the same place the computer did it. You understand? So a lot more sort of precision involved in this lingual deal. So here's a classic example. If you look at that 4.3, you can see there's no room in the arch for it, and you're not going to be able to get a bracket on it straight away. But what you can do is let that 014 wire do its magic. Sometimes you can put stops on it to give it added expansion, or you can put some compressed nitide core spring. But in this case, because of centerline shift, there's been a unilateral premolar extraction. It's allowing that tooth to migrate with some light power change. So you can see here 4.5 is coming back. And now you're seeing daylight for the teeth that weren't bracketed initially, which was your 3.2 and your 4.3. Now, this is what I really love about Lingual compared to clear aligners. With clear aligners, my God, there's so much guesswork. You kind of lose the fact that you are a trained orthodontist. You know what I mean? In a case like this, we know what to do on the labial. It just becomes harder on the lingual. You've got to start putting your thermoplastic pliers. You've got to cut a hole in one aligner. You've got to stop aligners, do your magic with some elastics, then rescan for more aligners. Here, you just think like an orthodontist. So what do? You bond a little button on this cuspid, and then you start slowly bringing it into the position you want it to be in. And when it's nearly there, right, as you can see here, then you can get your individual jig, like I showed you in the video. You can now etch, apply your primer, apply your adhesive. I'll go through all those with you when we do the actual course. And away you go. So now you've made room for that tooth. You couldn't get a bracket on initially. Now you can, but they've already known that. So that's already been planned in the system. Working up the wires now, going from your 014 copper nitide. Then when there's spacing there, you're going to your 1616, then your 1622, and finally your 1825. Yeah, so that's just showing you a photo of the new jigs there. So I hope you're getting how predictable Lingual has become. Now, if you're going to use a Harmony case, obviously you need to use their portal. The way this works, you got to communicate with the technician. Nowadays, it's all online. You can fill out the lab form, scan it, and send it to them with your digital model. In the old days, I would fill that out by hand. I would then take PVS impressions, a wax bite, and put all that in a box, ship it off back then all the way to the US. Now, the Harmony Technical Center, which is doing the digital setup in Japan, they use CAD, which is your computer-assisted design, to take your malocclusion, get it set up. You have a look at it. They then help you design the pads, as I said, so that they're out of the bite, and they're going to help you with the movement. You then have computer-assisted manufacturing, which we talked about before, to get that ideal pad and to have that attached to the bracket. They will then make you a transfer tray. In this case, that's the situation where you're going to use MaxiSem. So with this setup, you can do 7 to 7. If you're a beginner and you haven't done indirect bonding before, you can ask the lab to cut that in half, or in some beginners go 7 to 4 in one section, then 3 to 3, and then 4 to 7. But that's 3 times of isolation, 3 times of etching. You know, I just find it's quite easy to do the whole arch, right? Just a little bit about how this could distinguish your practice as we come to the sort of close of this lecture. The big question people ask me, Derek, why are you doing lingual when you can do aligners? Well, I think I've already addressed that. One reason is there are cases that I don't feel comfortable. I'm not like a Diego Pedra or Ivan Mulligan, who, you know, are the like gurus in aligners because they've been doing it for so long. I still have limited aligner skill, but I just like to still be able to think like an orthodontist. And this allows me to use my years of labial fixed wire training on the lingual very compatibly. And I can use that whole self-ligating concept as well. So aesthetically, you know, we all know what aligners really look like, you know, with the attachments on, you know. And so when a patient sits down and they say, look, you know, and I'm trying to sort of steer them towards a lingual setup because I know the complexity, I'm going to say, listen, you know, I'm going to have to file your teeth down using the aligners. You know, the aligners are going to kind of look like this, and they might even look worse once you've had a chicken tandoori, blah, blah, blah. But if I put them on the inside, you know, this is so these are sort of things that I highlight, right? And I think it's you can just Google stuff like what patients are saying about their treatment, and here they're talking about I thought it was invisible, it's not really. The attachments, they strip my teeth, you know, blah, 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 blah. The other big one, though, is compliance. And I have had cases I've started with aligners, and I certainly learned, you know, 4th aligner, the patient's not wearing it. And they say, oh, I'm really sorry, Dr. Mahony, I'll promise next time. You know, unfortunately, we can't glue aligners in the mouth, right? So what I then say is, listen, you want the aesthetics, but you're a non-complier. Let's use that same digital setup and go to a lingual system, right? Yeah, lots of things that we can say, but the speed is what I really like, right? The progress of what can be achieved in aligner versus lingual. You saw a similar case to this a minute ago that in 6 to 8 weeks had already created the space. Just showing you again. So like a 9-month treatment plan as opposed to over there, you're nowhere near finishing in that same period of time. So it's just something for you to consider, and a bit of extra training will help you at least be able to offer that. Now, what else do I find great with lingual? Because I can customize my wires, I get much better arch coordination, and I don't have those buccal segment settling issues, which I know we've overcome a lot with the Chewies and things like that with the aligner therapy. But these are just some of my thoughts, right? So when it comes to case selection, obviously your first case should be a really simple non-extraction, mild crowding type situation. As you get more experience, you can tackle these sorts of babies where you, based on the face. Now people say, well, why aren't you extracting here? Well, you extract if the profile is really full. In my book, because of superelastic NiTi, because of self-ligating brackets, I can choose to do non-extraction using light forces without pushing teeth through the bone. If the face permits me to, sorry, the face lends itself to non-extraction treatment. So in this sort of situation, you can see a NiTi wire, one tooth not engaged at all, not even the bracket on, the other light coil spring to slowly make the room. And as you work up the system, you can come in with your individual jigs, pick up those teeth, and away you go, right? So definitely more aesthetic. I find more reliable and predictable, i.e. efficient with time, because you don't have the compliance, right? And as I said, people talk about lingual. I get more referrals from my lingual patients than any other patient in my practice. They kind of feel that they're kind of, got the Ferrari of braces in their mouth, and they want to tell their friends about it. They love to say, hey, I bet you didn't know I have braces, and they lift their head up. And, it increases case starts, because a lot of people who in their mind thought, yeah, I'd never be a case of orthodontics at my age, or because I am too embarrassed to show braces, et cetera, right? So as far as the fee, I mean, that really varies from country to country. I know in Japan, the orthodontic fees are probably one of the highest in the world, right? But, I like this quote from Cliff Alexander, charge what you're worth, but be worth what you charge. So obviously in your first couple of cases, you're not going to charge the full fee. But in my practice, I charge more for lingual than I do for the aligner treatment. And I educate the patients why. But in our practice, we have payment plans, interest-free, 2 years. So it makes, I think, that the treatment very, very affordable. There's also some great videos you can get to play in the waiting room. Now, I'll leave this slide up. This is your next point of contact. I work a lot, as I said, with Azo International. They're in Ginza in Tokyo. And the lady you want to deal with is Hiromi. And that is her direct email. So please contact her. I've given you my email. And that will allow us to start this process, but you do need to register with them. You need to you have to set up an account, and you do need to certify to do the training, right? So that's just a quick overview of what I wanted to discuss with you tonight. Now, I'm just going to go to so if you want a copy of the slides, or if you want some of the teaching manuals, please email me. If you're really enthusiastic and you want to learn to do lingual, contact me. Depending on where you are, I'll put you in touch with the American Orthodontic rep. But if you're in Australia, New Zealand, then it's easy because we work with the Azo International Lab. So thanks again for taking the time out to listen during the CPD lockdown. I hope that was just a bit of even if you don't do braces and you're a general dentist and you want to be able to know who to refer cases to who don't want to show braces, lingual orthodontist is the guy to look for when you've got that patient who wants absolute aesthetics and doesn't want any stripping of their teeth, et cetera, et cetera. So as I said, this will be on the Facebook for the next 2 to 3 days. Then I swap it to the website, eodo.teachable.com, so that you can then look at it at your leisure. And feel free to keep in touch with me. But thanks again for listening. And I will then in the meeting, I can't really do questions because I'm doing the lecture. Normally, I read the questions out for the other thing, but you can email me and or wherever this feed is, whether it's on Derek Mahony Facebook 1, 2, 3, or 4, just put in the comments section your questions and I'm happy to answer them for you. Other than that, enjoy your evening or morning, wherever you may be, and hope you return back to full practice really soon.